Hi everyone. Your patient may have a cuff trach. Let's talk about the types of cuff trachs. A cuff trach has a balloon-like feature at the distal end of the tube. The cuff can be inflated or deflated with air or water depending on the type of cuff. Inflated cuff allows the air delivered from the ventilator to the lungs and back to the ventilator on exhalation to be measured and monitored. Cuff pressure must be at physician's orders. To do that, you need a pressure manometer. If ordered in milliliters, you need a syringe. You routinely assess cuff pressure to make sure it's at physician settings to prevent excessive pressure on the tracheal mucosa and tracheal capillary. Typically, air cuff trachs are high volume, low pressure trachs. They have a large surface area in contact with the tracheal wall. When an air cuff is deflated, it still occupies a large amount of space, which may result in difficulty tolerating a speaking valve or cap. Low volume, high pressure cuffs are typically water cuff trachs and they conform to the shaft of the trach. Its high pressure against the tracheal wall presents a risk for tissue damage if used for prolonged periods of time. The cuff can be ideal for patients who may need one or more future procedures under anesthesia. When it's deflated, it conforms to the shaft as if it was cuffless. Not commonly used, the cuff is filled with foam. It spontaneously inflates to atmospheric pressure. Even when air and water is squeezed from foam, it spontaneously fills with air. Cuff trachs do not prevent aspiration. The definition of aspiration is any material that passes below the level of the vocal fold. These are some of the factors physicians consider when determining the most appropriate trach tube for the patient's unique medical needs. All right, you beautiful healthcare workers, bye for now.